Welcome to Medsplain, where we talk about complex medical topics in easy-to-understand ways. In today's video, we are going to be talking about Hashimoto's disease. Remember that this is simply an informative medical video designed for patient education. Any medical decisions should be left to the authority of a licensed physician. If you experience a medical emergency, call 911 immediately. Hashimoto's disease is an autoimmune condition of the thyroid, the butterfly-shaped gland in your neck that wraps around your windpipe. The thyroid gland produces hormones primarily to help regulate body temperature in cooperation with the brain, as the hormones it releases increases energy use in body cells, leading to heat production. Other functions include increasing the amounts of nutrients circulating in the blood, increasing blood flow to many organs and areas of the body, and being crucial for proper growth of the body and development of the nervous system. In Hashimoto's, the immune system sends out attack signals, antibodies, that lead to the destruction of thyroid cells and cause inflammation. This is different from Graves' disease. There, the antibodies don't attack the cells, but instead trick them into working overtime, causing the thyroid to become overactive. Since it takes some time for thyroid function to deteriorate, symptoms will progress slowly over the years. Symptoms of Hashimoto's disease may include fatigue and sleepiness, increased sensitivity to cold, weight gain and a puffy face, dry skin, constipation, muscle weakness, aches and stiffness, irregular or excessive menstrual bleeding, problems with memory and mood, swelling of the neck, goiter, hair loss, enlargement of the tongue. People are at increased risk for developing Hashimoto's disease if they are female, they are middle-aged, between 30 and 60, they have another autoimmune disease, they have a family history of Hashimoto's or other autoimmune diseases, they have already had a pregnancy, they have an excessive intake of iodine, they have excessive exposure to radiation. The major complication with Hashimoto's disease is hypothyroidism, reduced thyroid function. Treatment of hypothyroidism usually involves taking a medication called levothyroxine, which is just synthetic thyroid hormone and is identical chemically. Since the thyroid is damaged in Hashimoto's disease, levothyroxine will need to be taken every day for the rest of your life, and a healthcare provider will prescribe the specific amount, usually needing to be adjusted depending on the body's response to it and need for it day to day. If you take too much levothyroxine, this can cause side effects, collectively called thyrotoxicosis, too much thyroid hormone. These symptoms may include a fast or irregular heartbeat, unexplained weight loss, anxiety or irritability, sensitivity to heat, or changes in period. Some foods that may help with absorption of levothyroxine into your body include iron and calcium supplements, sucralfate, an ulcer medication, aluminum hydroxide, and cholestyramine, but ask your healthcare provider if these are right for you. Some foods that should be avoided as they exacerbate the disease are gluten, dairy, soy, rice, corn, aspartame, a common artificial sweetener, pork, and eggs for their pro-inflammatory properties, and iodine-rich foods such as seafood, seaweed, multivitamins, or foods that are made using iodized salt or dough, as excess iodine causes more recognition of the thyroid by antibodies. Thank you for learning from Medsplain. We hope our explanations were concise and easy to understand. If you have any feedback, feel free to comment or contact medsplainbusiness@gmail.com. Remember to like or subscribe to support furthering patient education.